Radical nephrectomy is the preferred treatment for tumors extending into inferior vena cava. Robotic radical nephrectomy has been increasingly utilized in the management of renal carcinoma, including complex cases such as T3b kidney tumors. We present the case of a 78-year-old male patient, obese with a muscle mass index of 32, on haemodialysis due to chronic kidney disease, who present persistent elevation of C-reactive protein, for which reason an abdominal CT scan was performed, in which a renal interpolar lesion of 7.7 cm in diameter was observed, associated with thrombus in the ipsilateral renal vein. Both kidneys also show a significant atrophy and multiple renal cysts. The diagnosis, it was decided to perform a robot-assisted radical nephrectomy and thrombectomy. Under general anesthesia and in the left lateral decubitus position, docking of the Da Vinci Xi system was performed. After descending the colon and the Kocher maneuver, the renal vessels and the vena cava were dissected, as well as the hypogastric vein, which was clamped and sectioned early. After identification of the structures and their isolation, we proceed to the placement of basal loops for clamping, which is carried out using the Rommel tourniquet technique. The contralateral renal vein was isolated, as well as the distal and proximal vein, confirming with ultrasound that the thrombus has been included in the clamped section. We start the cavotomy in the anterior surface of the cava. We remove the tumor thrombus with unblocked extraction, and after this step we cut the posterior face of the renal vein and also early bedding of the thrombus. The vascular transit is reconstructed with two running hemisutures of non-absorbable monofilament. After verifying correct hemostasis, the nephrectomy was completed and the surgical specimen was removed. The surgical time was 300 minutes with contralateral renal vein climbing time of 22 minutes. The blood loss was 800 milliliters. The patient discharge was on the 7th postoperative day. The pathological report showed a 4-month grade 3 renal clear cell carcinoma with ocular invasion and extension to the renal vein T3b. Based on our experience and following previously published studies, we conclude that robotic-assisted surgery is a viable and safe option for T3b kidney tumors, performed by skilled surgeons in high-volume centers to optimize outcomes.